Hi, good day everyone. I am Professor Victor Ho, an occupational and public health specialist from Department of Social Palliative Medicine, Faculty of Medicine, University of Malaya. So if you are doing aerosol generating procedure, you need to wear an N95. But before we actually wear an N95 or select the correct N95, we need to understand how to do it. All right. So today we're going to try to explain to you what is the different type of N95 and how do you do a fit test or a fit check. All right. So let's start off with looking at two types of N95. This type of N95 is with a what we call easy breather. It allows you to breathe easily through this valve. So there's a valve in front here. This is a one-way valve. The second type of N95 is an N95 without the valve. Alright, there's no valve. Basically, the whole surface is the filter. So it filters the air into your lungs. This is N95. If you look at it, it's basically N95. It's written here, alright, on the side, and it has two bands, alright. Two bands. Basically, how you put this on is you put it on, alright, with the two bands in front, holding it as a cup, alright, and then putting the two bands behind and let it tightly fit into your mouth. Then basically you want to check whether it's fitting or not. Alright? So you want to see whether air actually get out from your N95 face mask or not. So that is where the air whether the air escape from here or not. So to make sure the air doesn't escape from your nose, you clip your nose. There's a metal clip to clip your nose properly. You will see it looks like a fitting N95 respirator. Alright? So to fit check it, we basically either we inhale and exhale, and you'll see whether air actually escape from your N95. This is called fit check. Every time before you use your N95, you should fit check. But before that, you should fit test, because we know that not all face answers are the same, and everybody should be checked whether the N95 suit their face or not. So this is the N95 that can be used for sterile surgical procedure. You must understand that this can be used for sterile surgical procedure. There's another type of N95 with a little valve in front. Alright? This valve is basically something called a easy breather valve. Alright, so it's a one-way valve. So the valve basically allows air to travel this way. Alright, it allows air to travel from your mouth and it comes out through the little flap here that actually opens up. Alright, if you can see, there's a little flap here that can opens up, and you can see my pen coming out. Alright, so that's the little flap there. So the little flap opens up every time you exhale or you breathe out. So it is not basically should not be used for a sterile surgical procedure, because your contaminant from yourself will basically contaminate the area you are working on. So you should not use this for a sterile surgical procedure. If you want to do a sterile surgical procedure, you should wear an N95 which does not have the easy breather valve. This is the easy breather valve. This is good because it actually prevents the inside of the N95 to become humid and wet and difficult to wear. And you breathe in and breathe out. You see that when I breathe out, of course you really can't see it, but when you put your hand below this, you will see that the air actually comes out from here. That's why this is called an easy breather. It allows you to breathe easily, and it doesn't make your mouth, make your mask become very warm and humid and difficult. Okay, so this is today I have explained about what is the difference between an N95, alright, without the easy breather, N95 with easy breather, and also what is the difference between fit testing and fit checking. And every time before you don on your N95, you put on your N95, you need to make sure you have a fit check done. Thank you.